Hospital-acquired infections is equivalent to one large commercial airliner falling out of the sky with no survivors each and every day. In the United States, nearly 100,000 people still die each year from hospital-acquired infections. Infections acquired in a hospital or healthcare facility unrelated to whatever health issue took the patient there in the first place. Roughly 1.7 million hospital-associated infections occur annually in acute care hospitals, which results in a total direct, indirect, and non-medical social costs estimated at roughly $147 billion annually. For these reasons, dramatic efforts are applied to improve hand hygiene in hospitals, and the effort has been demonstrated to have a favorable impact. Despite these efforts, hospital-acquired infection rates remain unacceptably high. One gap in our hygiene protocol that can be contributing to the problem is hygiene for the clinician's third hand, the stethoscope. Several recent studies have demonstrated that stethoscopes are highly contaminated, yet clean between patients less than 10% of the time. Furthermore, when stethoscopes are cleaned, the contamination level is reduced but not eliminated. A validated solution to stethoscope contamination with an aseptic barrier could rapidly and effectively resolve this problem. Imagine the impact on our mortality and cost if change were introduced into our hospital infection control procedures. Thank you, Sandra Seek, registered nurse, healthcare reform business analyst.